What is gout arthritis? Gout is a common and very painful form of inflammatory arthritis. It occurs when high levels of a substance called uric acid build up in the blood, leading to the formation of sharp, needle-like crystals in and around a joint. The body's immune system attacks these crystals, causing a sudden and severe inflammatory response. The most classic sign of gout is a sudden, excruciating attack of pain, swelling, redness, and tenderness in a single joint, most famously the big toe. What causes gout? The root cause of gout is hyperuricemia, which means having too much uric acid in your blood. Uric acid production. Uric acid is a natural waste product created when the body breaks down substances called purines. Purines are found naturally in your body's cells and also in certain foods. The problem: normally, your kidneys filter uric acid from your blood and excrete it in your urine. Gout occurs when either your body produces too much uric acid or your kidneys excrete too little uric acid. This is the more common reason. When uric acid levels become too high, it can't stay dissolved in the blood and crystallizes in the cooler parts of the body, such as the joints. These sharp crystals trigger the intense pain and inflammation of a gout attack. Symptoms of a gout attack. Gout attacks are notorious for their sudden and severe onset, often waking a person up in the middle of the night. Key symptoms include intense joint pain. The pain is often described as throbbing, crushing, or excruciating. While the big toe is the most common site, a condition called podagra, gout can also affect other joints, like the ankles, knees, elbows, wrists, and fingers. Swelling and redness. The affected joint becomes very swollen and the overlying skin turns red or purplish, looking like an infection. Extreme tenderness. The joint is so sensitive that even the weight of a bed sheet can be unbearable. Warmth. The affected area feels hot to the touch. Limited range of motion. It becomes very difficult to move the joint during an attack. An attack typically peaks within 12 to 24 hours and can last for a few days to a couple of weeks if left untreated. Stages of gout. Gout often progresses through 4 stages. Asymptomatic hyperuricemia. Uric acid levels are high, but there are no symptoms. Treatment isn't usually needed at this stage. Acute gout attack. The first painful episode occurs. Interval gout, or intercritical gout. The period between attacks where there are no symptoms. The uric acid crystals are still present in the joint, causing low-level damage. Chronic tophaceous gout. This develops after years of recurrent attacks. Uric acid crystals form large deposits called tophi, or hard, chalky lumps under the skin, which can cause permanent joint damage, deformities, and chronic pain. Risk factors for gout. Certain factors increase your risk of developing gout. Diet. A diet high in purine-rich foods, red meat, organ meat like liver, certain seafood like anchovies and sardines, alcohol, especially beer, and sugary drinks, high fructose corn syrup. Obesity. Being overweight increases uric acid production and reduces its excretion by the kidneys. Medical conditions. High blood pressure, diabetes, metabolic syndrome, and chronic kidney disease. Medications. Certain drugs like diuretics or water pills and low-dose aspirin can raise uric acid levels. Genetics. A family history of gout increases your risk. Age and sex. Gout is more common in men as they have higher uric acid levels. However, after menopause, women's uric acid levels approach those of men and their risk increases. Diagnosis. A doctor can diagnose gout through joint fluid analysis, the gold standard. A needle is used to draw a sample of fluid from the affected joint. The fluid is then examined under a microscope to look for the telltale uric acid crystals. Blood test. This measures the level of uric acid in your blood. However, uric acid levels can sometimes be normal or even low during an acute attack, so this test isn't definitive on its own. Imaging. X-rays can help rule out other causes of joint pain and can show joint damage in chronic gout. Ultrasound can detect uric acid crystals in the joint. Dual energy CT scan, a specialized scan that can visualize and identify uric acid crystal deposits. Treatment. Gout treatment has two main goals: managing the acute attack and preventing future attacks by lowering uric acid levels. 1. Treating an acute attack. The focus is on rapid pain and inflammation relief. Non-steroidal anti-inflammatory drugs, over-the-counter options like ibuprofen, Advil, or Motrin, or stronger prescription NSAIDs like indomethacin. Colchicine, a medication that effectively reduces gout pain but can have side effects like nausea and diarrhea. It's most effective when taken at the first sign of an attack. Corticosteroids, powerful anti-inflammatory drugs like prednisone, can be taken as pills or injected directly into the joint for fast relief. 2. Preventing future attacks, long-term management. For those with recurrent gout, tophi, or joint damage, doctors recommend medications to lower uric acid levels. Xanthine oxidase inhibitors, these are the first-line drugs. They work by blocking the production of uric acid. Examples are allopurinol and febuxostat. Uricosurics. These drugs help the kidneys remove uric acid more effectively. An example is probenecid. Lifestyle and diet management. Lifestyle changes are crucial for managing gout. Limit high purine foods. Reduce your intake of red meat, organ meat like liver, certain seafood like anchovies and sardines. Avoid alcohol and sugary drinks. Beer and fructose-sweetened beverages are major triggers. Stay hydrated. Drink plenty of water to help your kidneys flush out uric acid. Eat a healthy diet. Focus on fruits, vegetables, whole grains, and low-fat dairy. Some studies suggest that cherries and vitamin C may help lower uric acid. Maintain a healthy weight. Gradual weight loss can significantly lower uric acid levels. Avoid crash dieting, which can temporarily raise them. During an attack, rest and elevate the joint and apply a cold compress to help reduce swelling and pain. When to see a doctor. You should see a doctor if you experience sudden, intense pain in a joint. If you also have a fever and the joint is hot and inflamed, seek immediate medical care, as this could be a sign of a joint infection, which is a medical emergency. Disclaimer: this information is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.